I think there was a point in the discussion today that was kind of an aha moment for me, in that there was a patient representative who talked about the fact that we can design systems where people transition back towards primary care or community care after receiving care from a specialist. But we often don't factor in the sense of trust that that patient might have in the different levels of the system. So one of the examples that was given was an individual who perceived, or whether or not it was a reality or not, but perceived that their primary care provider misdiagnosed them, and it was only that at that specialist level did they feel they were getting appropriate care. So then to have a system that's now designing that transition back to primary care has to some way factor in that level of trust and rebuild that trust if it's to be successful. From a systems perspective, which is kind of where my head is we need to look at how do we integrate the transition of cancer care from the specialty realm, but then back into not just a primary care realm, but an integrated primary health care philosophy. So looking at an interprofessional approach to how we support patients through their cancer journey and into survivorship. So I think that when we look at it through a traditional medicalized model, it becomes a more daunting task than it necessarily has to be. And in fact, we should be looking at opportunities to leverage a wider number of skill sets, providers, and community agencies to participate in supporting a patient through their needs.